Master the D drugs. Here are the 25 most common medications tested. How many do you recognize? Dabigatran is used to prevent and treat blood clots, particularly in atrial fibrillation and deep vein thrombosis. Dacarbazine is used to treat various cancers, including malignant melanoma and Hodgkin lymphoma. Dactinomycin is used in chemotherapy to treat various cancers, including Wilms's tumor and rhabdomyosarcoma. Dantrolene is used to treat muscle spasms, spasticity, and malignant hyperthermia. Dapagliflozin is used to treat type 2 diabetes mellitus, heart failure, and chronic kidney disease. Darunavir is used to treat HIV infection. Dasatinib is used to treat certain types of chronic myeloid leukemia and acute lymphoblastic leukemia. Deferasirox is used to treat chronic iron overload in patients receiving blood transfusions. Denosumab is used to treat osteoporosis, bone loss in cancer, and to prevent skeletal-related events in cancer with bone metastases. Desmopressin is used to treat diabetes insipidus, nocturnal enuresis, bedwetting, and certain bleeding disorders. Dexamethasone is used to treat inflammatory conditions, allergic reactions, certain cancers, and cerebral edema. Dexmedetomidine is used for sedation in critically ill patients in an intensive care setting and for procedural sedation. Dextromethorphan is used to suppress cough. Diazepam is used to treat anxiety disorders, seizure disorders, muscle spasms, and alcohol withdrawal. Digoxin is used to treat heart failure and certain heart rhythm problems, atrial fibrillation. Diltiazem is used to treat high blood pressure, angina, and certain heart rhythm disorders. Diphenhydramine is used to treat allergic reactions, insomnia, and motion sickness. Diphtheria and tetanus toxoids in a cellular pertussis, DTAP. Vaccine is used to provide active immunity against diphtheria, tetanus, and pertussis, whooping cough. Donepezil is used to treat Alzheimer's disease. Dopamine is used to treat low blood pressure, hypotension, and low cardiac output, often in shock states. Doripenem is used to treat severe bacterial infections, including complicated intra-abdominal infections and complicated urinary tract infections. Doxazosin is used to treat high blood pressure and benign prostatic hyperplasia, BPH. Doxorubicin is used in chemotherapy to treat various cancers, including breast cancer, lymphomas, and sarcomas. Doxycycline is used to treat various bacterial infections, including respiratory tract infections, skin infections, and Lyme disease. Duloxetine is used to treat major depressive disorder, generalized anxiety disorder, diabetic neuropathic pain, fibromyalgia, and chronic musculoskeletal pain. Great job. Let's keep going. Here are the adverse reactions of the D drugs that exams love to test. Dabigatran. Adverse reactions: bleeding, hemorrhage, dyspepsia, abdominal pain, nausea, gastritis-like symptoms. Dacarbazine. Adverse reactions: severe nausea and vomiting, myelosuppression, leukopenia, thrombocytopenia, flu-like syndrome, alopecia, liver enzyme elevation. Dactinomycin. Adverse reactions: myelosuppression, severe, nausea, vomiting, mucositis, alopecia, skin reactions, radiation recall phenomenon, hepatotoxicity. Dantrolene adverse reactions: drowsiness, dizziness, muscle weakness, diarrhea, hepatotoxicity, can be severe, pleural effusion, rare. Dapagliflozin, adverse reactions: genital mycotic infections, urinary tract infections, increased urination, hypotension, hypovolemia, diabetic ketoacidosis, rare but serious. Darunavir, adverse reactions: diarrhea, nausea, rash, headache, abdominal pain, elevated liver enzymes, hyperlipidemia. Dasatinib adverse reactions: myelosuppression, thrombocytopenia, neutropenia, anemia, fluid retention, pleural effusion, peripheral edema, diarrhea, headache, fatigue, rash. Deferasirox adverse reactions: nausea, abdominal pain, diarrhea, skin rash, headache, increased serum creatinine, elevated liver enzymes, ocular disturbances rare. Denosumab adverse reactions, musculoskeletal pain, pain in extremity, hypercholesterolemia, cystitis, osteonecrosis of the jaw, ONJ, atypical femoral fractures, hypocalcemia. Desmopressin adverse reactions, headache, nausea, abdominal cramps, hyponatremia due to fluid retention, facial flushing, rhinitis, nasal spray. Dexamethasone, adverse reactions, fluid retention, hypertension, hyperglycemia, increased appetite, weight gain, mood changes, insomnia, osteoporosis long-term, increased infection risk, muscle weakness. Dexmedetomidine, adverse reactions, hypotension, bradycardia, nausea, dry mouth, hypertension, with rapid administration. Dextromethorphan, adverse reactions, dizziness, drowsiness, nausea, vomiting, constipation. High doses can cause euphoria, hallucinations, and CNS depression. Diazepam, adverse reactions, drowsiness, fatigue, ataxia, dizziness, confusion, dependence withdrawal. Digoxin, adverse reactions, arrhythmias, bradycardia, tachycardia, AV block, nausea, vomiting, anorexia, visual disturbances, yellow-green halo, fatigue, weakness, confusion, signs of toxicity. Diltiazem, adverse reactions, edema, peripheral, headache, dizziness, bradycardia, flushing, nausea, constipation. Diphenhydramine, adverse reactions, drowsiness, dizziness, dry mouth, blurred vision, urinary retention, constipation, paradoxical excitation in children. Diphtheria and tetanus, toxoids, and acellular pertussis, DTAP. Vaccine adverse reactions, pain, redness, swelling at injection site, fever, fussiness, loss of appetite, vomiting, drowsiness. More severe reactions like seizures or severe allergic reactions are rare. Donepezil. Adverse reactions, nausea, vomiting, diarrhea, insomnia, muscle cramps, fatigue, anorexia, bradycardia, syncope. Dopamine adverse reactions, tachycardia, arrhythmias, hypertension, angina, nausea, vomiting, headache, vasoconstriction, leading to tissue ischemia at high doses or extravasation. Doraipinum. Adverse reactions, diarrhea, nausea, headache, rash, C. difficile infection, seizures, rare, especially in patients with CNS disorders or renal impairment. Doxazocin. Adverse reactions, dizziness, headache, fatigue, orthostatic hypotension, first dose phenomenon, somnolence, palpitations. Doxorubicin, adverse reactions, cardiotoxicity, dose-dependent, can be fatal. Myelosuppression, nausea, vomiting, severe. Alopecia, complete. Mucositis, red discoloration of urine. Doxycycline, adverse reactions, nausea, vomiting, diarrhea, esophageal irritation/ulceration, photosensitivity, candidiasis, tooth discoloration in children 8 years old. Duloxetine, adverse reactions, nausea, dry mouth, insomnia, somnolence, constipation, dizziness, sweating, fatigue, sexual dysfunction, liver enzyme elevation. Let's finish strong by doing the contraindications or black box warnings of the C drugs. Dabigatran. Contraindications: active pathological bleeding, mechanical prosthetic heart valves. Hypersensitivity to dabigatran. Black box warning: premature discontinuation. Premature discontinuation of dabigatran increases the risk of thrombotic events. If anticoagulation must be discontinued for a reason other than pathological bleeding, consider coverage with another anticoagulant. Spinal/epidural hematoma. Increased risk of spinal or epidural hematoma when used in patients receiving neuraxial anesthesia or spinal puncture. These hematomas may result in long-term or permanent paralysis. Dacarbazine. Contraindications. Hypersensitivity to dacarbazine. Black box warning. Hepatotoxicity and myelosuppression can cause severe liver injury and significant bone marrow suppression. Monitor liver function and blood counts closely. Dactinomycin. Contraindications. Active infection, especially herpes zoster. Infants less than 6 months of age. Black box warning. Hepatotoxicity, myelosuppression, anaphylaxis can cause severe and life-threatening liver damage, severe bone marrow suppression, and hypersensitivity reactions, including anaphylaxis. Dantrolene contraindications. Active hepatic disease for chronic spasticity management, where spasticity is utilized to maintain upright posture or balance. Black box warning. Hepatotoxicity can cause severe and potentially fatal liver damage. Liver function tests should be performed before and during therapy. Dapagliflozin contraindications. Severe renal impairment, end-stage renal disease, ESRD, or dialysis, hypersensitivity to dapagliflozin. Black box warning. None. Note: SGLT2 inhibitors as a class have warnings regarding diabetic ketoacidosis, serious genital mycotic infections, and risk of limb amputation for canagliflozin, but dapagliflozin does not have a black box warning. Darunavir contraindications. Concomitant use with certain highly CYP3A-dependent drugs, for example, rifampin, St. John's wort, some antipsychotics, benzodiazepines. Hypersensitivity to darunavir or any component, for example, sulfonamides. Black box warning. None. Dasatinib contraindications. Hypersensitivity to dasatinib. Black box warning. None, but carries warnings for myelosuppression, fluid retention, including pleural effusion, and QT prolongation. Deferricerox contraindications. Severe renal impairment, high-risk myelodysplastic syndromes, advanced malignancy, or low platelet counts, for some formulations. Black box warning. Renal and hepatic toxicity can cause acute renal failure and severe liver damage, including hepatic failure. Monitor renal and hepatic function. Gastrointestinal hemorrhage can cause fatal GI hemorrhage, particularly in elderly patients with advanced malignancy. Denosumab contraindications. Hypocalcemia must be corrected prior to therapy. Hypersensitivity to denosumab. Black box warning. None. Note: significant risks include ONJ, atypical femoral fractures, severe hypocalcemia. Desmopressin. Contraindications. Hyponatremia or history of hyponatremia, moderate to severe renal impairment. Syndrome of inappropriate antidiuretic hormone, SIADH, heart failure. Black box warning. Hyponatremia. Severe hyponatremia, leading to seizures or death may occur, particularly with intranasal use in children and adolescents for primary nocturnal enuresis. Dexamethasone. Contraindications. Systemic fungal infections, hypersensitivity to dexamethasone. Black box warning. None. Dexmedetomidine. Contraindications. Hypersensitivity to dexmedetomidine. Black box warning. None. Dextromethorphan contraindications. Concomitant use with MAOIs, or within 14 days of discontinuing. Black box warning. None, but abuse potential, especially at high doses, is a concern. Diazepam contraindications. Acute narrow-angle glaucoma, severe respiratory insufficiency, sleep apnea syndrome, severe hepatic insufficiency, hypersensitivity to diazepam or other benzodiazepines. Black box warning. Concomitant use with opioids may result in profound sedation, respiratory depression, coma, and death. Reserve concomitant prescribing for use in patients for whom alternative treatment options are inadequate. Digoxin contraindications. Ventricular fibrillation, hypersensitivity to digoxin. Black box warning. None, but has a narrow therapeutic index and high toxicity risk. Diltiazem. Contraindications. Sick sinus syndrome, unless a functional pacemaker is present. second or third degree AV block, unless a functional pacemaker is present, severe hypotension, acute myocardial infarction, and pulmonary congestion, hypersensitivity to diltiazem. Black box warning, none. Diphenhydramine contraindications, newborn or premature infants, breastfeeding mothers, narrow-angle glaucoma for anticholinergic effects, benign prostatic hyperplasia, asthma exacerbation, some formulations. Black box warning, none. Diphtheria and tetanus at toxoids, intracellular pertussis, DTAP, vaccine contraindications, severe allergic reaction, for example, anaphylaxis, to a previous dose or to any component of the vaccine, encephalopathy not attributable to another identifiable cause within 7 days of a previous pertussis vaccine dose. Black box warning, none. Donepezil contraindications, hypersensitivity to donepezil or piperidine derivatives. Black box warning, none. Dopamine contraindications, pheochromocytoma, uncorrected tachyarrhythmias, ventricular fibrillation, hypersensitivity to dopamine. Black box warning, none, but extravasation can cause tissue necrosis requiring immediate phentolamine. Doripenem contraindications, hypersensitivity to doripenem or other carbapenems, or to beta-lactam antibiotics. Black box warning, none, but carries warnings for seizures and C. difficile-associated diarrhea. Doxazocin. Contraindications, hypersensitivity to doxazocin or quinazolines. Black box warning, none. Doxorubicin contraindications, marked myelosuppression, severe hepatic impairment, severe myocardial insufficiency, recent myocardial infarction, hypersensitivity to doxorubicin or other anthracyclines. Black box warning, cardiotoxicity, can cause irreversible myocardial damage leading to heart failure. The risk increases with cumulative dose. Myelosuppression can cause severe myelosuppression leading to infection or hemorrhage. Secondary malignancies, increased risk of acute myeloid leukemia and myelodysplastic syndrome. Extravasation can cause severe local tissue necrosis. Doxycycline. Contraindications, hypersensitivity to tetracyclines, severe hepatic impairment, use in children under 8 years of age due to permanent tooth discoloration and bone growth inhibition, pregnancy, breastfeeding. Black box warning, none. Duloxetine contraindications, concomitant use with MAOIs or within 14 days of discontinuing, uncontrolled narrow-angle glaucoma, severe renal impairment, severe hepatic impairment. Black box warning, suicidal thoughts and behaviors, increased risk of suicidal thoughts and behaviors in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders. Always remember, this information is for educational purposes and should not replace comprehensive drug references or professional medical advice.